Good morning, students. I already uploaded 3 videos on anterior cranial fossa, middle cranial fossa and posterior cranial fossa. That means the interior of the base of the skull. Today I will show you the exterior or inferior surface of the base of the skull. Mainly the important anatomical features, different foramens, different fissures and also important landmarks on the inferior surface, or it is also called Norma basalis. If we divide this inferior surface into 3 parts, one is the anterior part, that means it starts from the alveolar arch up to the posterior margin of the hard palate, up to this. Then it is middle part. Middle part means from this point up to the anterior margin of foramen magnum. So this is the middle part, and behind this is the posterior part. So I will discuss one by one, starting from anterior to posterior part. Let us discuss the anterior part first. So this is anterior part, and anteriorly this arch, U-shaped arch called alveolar arch, and it is a part of the upper jaw, that means maxilla, and this part is a hard palate. This hard palate, it is consisting of 4 bones. 4 bone means this is the palatine process of maxilla of this side, this is palatine process of maxilla of this side, and in between these 2 process is the intermaxillary suture, and behind the 1/4 part of the hard palate, it is found by the horizontal process of palatine bone of this side, and this is again horizontal process of palatine of this side. So this suture is the interpalatine suture. The 3/4 is the palatine process of maxilla and 1/4 is the horizontal process of palatine. Here is another suture between this process and this process called palatomaxillary suture. This side also palatomaxillary suture. So this is a very common question asked during 5 examination, how the hard palate is formed. And anteriorly, just behind the central incisor, there is a depression. This is called the incisive fossa, and incisive fossa laterally it is having one foramen called incisive foramen, and incisive foramen contains some important structure. The nerve is the long nasopalatine nerve which extends from above, that means from the nasal side, and one artery, it enters from below upwards, and this artery is the greater palatine vessels. And if you draw a line starting from this side and this side, and this line extends from the lateral incisor and canine, this side also, this triangular area in front is called the premaxilla. The importance of premaxilla is that it is ossified from separate center, and it is usually found in the young adults. Then come to the lateral side of the hard palate. Here is a groove. On each side there is a groove, and if you continue this groove up to this, here you will get one foramen on both sides. This foramen is just medial to the third molar tooth. This foramen is called the greater palatine foramen, which contains the greater palatine vessels and nerves. And behind this, here, this is called lesser palatine foramen. It is usually 2 in number, close to the pyramidal process of palatine bone, and this foramen contains lesser palatine vessels and nerve. And posteriorly, this hard palate, it ends in a crescenteric margin. It is a free margin, and in the midline, this process is called this one called nasal spine. So nasal spine is the midline elevation from the posterior border of the hard palate, and in front of this crescentic border there is a small ridge. This ridge is called the palatine crest, and behind this is the coena or posterior nares on both sides, and in the middle this bone is a vomer, and this coena, it is bounded medially by this vomer and laterally by the medial pterygoid plate, and inferiorly by the posterior crescentic margin of the hard palate and superiorly by the sphenoid. Next part is the intermediate part. This is intermediate part. I will discuss first the median structures, then paramedian or lateral structures. So in the midline or the median plane, this one is the vomer. This is the posterior border of the vomer. Next is the inferior surface of the body of the sphenoid, and more posteriorly it is the basilar part of the occipital bone. And here the vomer superiorly it is dividing into two ala, this one, and this ala articulates with the rostrum of sphenoid. If you see this sphenoid bone separately, this is the inferior surface, this is the ala of the vomer, and this is rostrum of the sphenoid. So here is the articulation, and on each side you can see the small foramen here. This is the vomer and this is the vaginal process of the medial pterygoid plate of sphenoid, and here you see this is vomerovaginal canal. So this is the vomerovaginal canal of one side and this is vomerovaginal canal of this side. Usually no structure pass through this vomerovaginal canal. And another canal is called the palatinovaginal canal, which leads to the posterior wall of the pterygopalatine fossa, and it is found between the vaginal process of the medial pterygoid plate and sphenoidal process of palatine bone. Then come to the paramedian structures. And the paramedian structure, first of all, you see here there are two pterygoid plates. One is medial, one is lateral. These two plates are the parts of the sphenoid bone. This is sphenoid bone. This is the anatomical position. So it is extending downwards, medial and lateral pterygoid plate. And now, if we see the from inferior side, it looks like this. So this is the two pterygoid plate, and above the medial pterygoid plate, there is a depression here. This is called scaphoid fossa, and the scaphoid fossa here is the principal or main origin of tensor veli palatini muscle, and more downwards this plate having a hamulus, this hook like projection, the hamulus for the tensor veli palatini muscle. And here you can see one bony process. This bony process from the posterior border of the lateral pterygoid plate. This is lateral pterygoid plate, and from this a ligament extends up to the spine of the sphenoid. This is spine. This is called pterygospinous ligament. And next to this pterygoid plate, we can see here the greater ring of sphenoid. The greater ring of sphenoid here, this is the infratemporal surface, and here we can see so many foramens, and this is the temporal bone. Here in the temporal bone we can see three parts mainly. One is the petrous part, then one is the squamous part here, and this is the tympanic part. So petrous, squamous and tympanic, all the three parts we can see on the undersurface. And the important part here is the spine of the sphenoid. This is spine of this side and the spine of this side. Why it is important? Because it is related to important nerves. Laterally is the auriculotemporal nerve, which is the branch of the mandibular nerve, and medially it is related to coratympanic nerve, this side. And on this side also you will get a sulcus called this one, called sulcus tubi. On this side, this is sulcus tubi. The sulcus tubi lodges the cartilaginous part of auditory tube. In the spine, you will get attachment of some muscles and ligaments. Two muscles are there. One is tensor veli palatini and another one is tensor tympani. And three ligaments are there. One is sphenomandibular ligament, next pterygospinous ligament, and number 3 is the anterior ligament of malleus. you may be asked what are the structures related to the spine, and if it is fractured, then what may be the consequences following the fracture of the spine of the sphenoid. So you must read the spine. And some foramen we can see here. This large foramen is there. This is called foramen ovale. This one. And behind this is the foramen spinosum, close to the spine. And the structures passing through the foramen ovale, I already discussed during my discussion on the middle cranial fossa. Again, I am repeating the structures passing through the foramen ovale. And it is easy to remember by remembering the four letters, and the word is the male, M-A-L-E. M stands for mandibular nerve, both its motor and sensory part. A stands for accessory meningeal artery, and L stands for lesser superficial petrosal nerve, and E stands for emissary veins. Besides this, one important vein also passes through this foramen, that is the anterior division of the middle meningeal sinus. Then posterior to this is the foramen spinosum. This foramen spinosum, the structures passing through this, you will remember by the three letters again, A-M-E-N, men. M stands for middle meningeal artery, E stands for emissary vein, and N stands for nerva spinosus, which is the branch from the trunk of the mandibular nerve. Besides this, another vein is there, that is called posterior division of the middle meningeal sinus. Then come to the mandibular fossa. Here, the mandibular fossa is a squamous part. Here, the head of the mandible articulates, forming a temporomandibular joint, which is a synovial joint, and this one is the tympanic plate or tympanic part. Between these two parts, there is a fissure called petrotympanic fissure. Very common question asked, what are the structures passes through the petrotympanic fissure? And the three structures you can remember in this way: CAA. C means coratympanic nerve, A means anterior ligament of malleus, and another A means anterior tympanic branch of maxillary artery. Next to this is the foramen lacerum. This larger foramen is marginal lacerated, so the name is foramen lacerum. It is found by this petrous part of temporal bone and the sphenoid bone, and also the basilar part of the occipital bone. So here you will get the foramen lacerum. In this foramen, there are some structures pass through this and some structures pass over this. The lower part of this foramen is closed by the fibrocartilage, and it is pierced by the nerve of pterygoid canal, which is formed by the greater petrosal nerve and deep petrosal nerve. Then it passes forward through a foramen. That foramen is here. Can you see the foramen? This one. This is anterior to the foramen lacerum. This is called pterygoid canal. Through this pterygoid canal, the structure passes is the nerve of pterygoid canal and vessels. And behind this foramen is the anterior opening at the apex of the petrous part for the carotid artery or internal carotid artery. If I show you the temporal bone separately, you get this one. So this is the anterior opening for the internal carotid artery. So foramen lacerum, posteriorly the anterior opening of the internal carotid artery at the apex of petrous part of temporal bone, and anteriorly here is the opening of pterygoid canal. Another structure you see here, this opening. This opening is the lower opening of carotid canal. The internal carotid artery, it passes through this opening and passes through the carotid canal and comes out through the anterior opening in the apex of the petrous part of temporal bone. So inside this is the internal carotid artery. The posterior part starts from the anterior margin of foramen magnum. This foramen magnum, it is anteroposterior diameter 3.5 centimeter and transverse diameter about 3 centimeter, and it is the largest foramen in the base of the skull. And anterior margin in the midline or middle point of the anterior margin is called Bayesian. Structures passing through the foramen magnum Some are anterior and some are posterior structures. Anterior means anterior to the alar ligament, posterior means posterior to the alar ligament. The structures passing through the anterior compartment or the fibroosseous compartment, these are apical ligament and upper band of cruciate ligament and membrana tectaria. And to the neurovascular compartment or posterior compartment, the structures are lower end of medulla oblongata with its meninges, fourth part of vertebral artery, which is surrounded by sympathetic plexus of nerves, then spinal root of accessory nerve, posterior spinal artery, which are 2 in number, and anterior spinal artery. All these things I discussed during my discussion on posterior cranial fossa. Just I repeated all the structures passing through the foramen magnum. And on each side of the foramen magnum, this is the condyle called occipital condyle. This occipital condyle, it articulates with the superior articular surface of the atlas, forming atlanto-occipital joint, and this is oval shaped and a biaxial ellipsoid joint. And in front of this condyle here, this is one foramen. This foramen is called anterior condylar foramen, leads to anterior condylar canal because it is anterior to the condyle, also called hypoglossal canal, because this structure passes through this canal is mainly the hypoglossal nerve. Besides hypoglossal nerve, another structure passes through this foramen, that is one artery. There is a meningeal branch of ascending pharyngeal artery. And posterior to this condyle, another foramen or depression is there. This foramen leads to posterior condylar canal, and the structures passes through is one emissary vein and one occasional artery, and that artery is the meningeal branch of occipital artery. Then posteriorly from the midline, one crest extending upwards. This is called external occipital crest, and it ends superiorly or prominence called external occipital protuberance. Both this protuberance and the crest, here there is attachment of a ligament called ligamentum nuchae, and the ligament nuchae, it is extending downwards up to the spine of 7th cervical vertebra. Then come to the more lateral side. Here is the jugular process. Jugular process is a part of the condylar part of the occipital bone. If we turn it, this is the condylar part, and here in the condylar part, this part is called the jugular process is there. This is a jugular process, is having one superior surface. If I see here, we cannot see the superior surface from this side. This is the inferior surface. Here you can see one foramen. This foramen on both sides called jugular foramen, and this foramen is formed when the petrous part of temporal bone articulates with this part of the occipital bone, forming a joint. This joint is primary cartilaginous joint, and it is united by the age of 25 years because it is primary cartilaginous joint. And the structures passing through the foramen I already discussed. I am just repeating once again, and you know the foramen is divided by the some bony process into 3 compartments, and anteriorly this foramen, the structure passes through is the inferior petrosal sinus, which is the first tributary of internal jugular vein, and to the middle compartment the structures passing are the 9th, 10th and 11th cranial nerves and meningeal branch of ascending pharyngeal artery, and one emissary vein occasionally. And to the posterior compartment, the structure, the main or important structure is the sigmoid sinus, which becomes internal jugular vein when it comes out through the jugular foramen. Behind this opening for the intercavitary artery, you will get one fossa. That fossa is called the jugular fossa. The jugular fossa just behind it, and in between jugular fossa and the opening of the internal carotid artery, in between these two, there is a canaliculus called tympanic canaliculus, through which the nerve passes is the tympanic branch of glossopharyngeal nerve. I am showing you the temporal bone separately. This is the right sided temporal bone. So this is the inferior surface. So here you can see this is the opening for the internal carotid artery and this is jugular fossa. And in between these two, this one is the tympanic canaliculus. And posteriorly, another opening is there called mastoid canaliculus, which is more clearly visible in the separate temporal bone. This one. Then come to this bony process, this projection from both sides. It is a process from the temporal bone. It is called the styloid process. And behind this styloid process, this another process is there which is more stout and broad. This is called mastoid process of temporal bone. So both the process you will get in the temporal bone. And in between these two processes there is foramen. This foramen. This foramen. This foramen is called stylomastoid foramen. The stylomastoid foramen transmits facial nerve, which comes out from the cranium and becomes the extracranial part. And one artery also passes through this foramen, that is stylomastoid branch of posterior auricular artery, which is one of the branches from the external carotid artery. And in the mastoid process, there is a notch medially here. Here, the muscle attached is the posterior biliary digastric, which is supplied by the facial nerve. That's all. Thank you very much.